third trimester of pregnancy has always been one of the most exciting times for me. This is the point in pregnancy when the baby grows the most and when most of pregnancy weight is put on.
Third trimester is from 28 weeks of pregnancy and on, and it's an important time, it's an exciting time. You're 2/3 through the pregnancy, so you've only got a little bit left to go before it's time to have that baby, and it's important to know what to expect.
We see our patients every 2 to 3 weeks at the beginning of the third trimester and then move to weekly at the end, starting about 36 weeks, when we begin to check to see if the cervix is starting to dilate and test for some routine things.
Between 35 and 36 weeks, we will do something called a Group B strip. It's a little swab in the vagina to check for a bacteria. I want to stress this is not an infection. And then if you test positive for it, you just get antibiotics when you go in to have the baby.
We may also offer certain vaccines like the pertussis vaccine at the end of pregnancy to help protect your baby in the first couple months of life.
Well, at 37 weeks, you're considered full term. So that's when everybody gets really excited. When can I have the baby? What do I look for? So you are going to want to look for contractions, and a good contraction is going to last about 1 minute. So you want to count from the start of one to the start of the other one. And 5 minutes or less apart for over an hour, that's usually a sign that you need to come in to be seen, that something may be happening. Another thing to look for is if your water breaks. And if that were to happen, you just get your stuff together and go to the hospital. There's no need to worry, especially if it's your first baby, that the baby's gonna come too quickly or anything like that. It typically does take a little bit of time. So just get your stuff together and head on to the hospital, and they'll call your doctor when you get there. I know the third trimester is a very exciting time, and we all get excited waiting for this baby to come. So if you have any questions, any concerns whatsoever, it's always a good idea to call your doctor's office, call your doctor, the hospital, or just go in to be seen.